geneticist from Melbourne, Australia. I gave this talk yesterday already at the research day, so apologies for those who are going to hear it twice. This is predominantly a radiology project that we've been doing, looking at brain MRI scans of people with FOXP1 syndrome. So what's a geneticist doing presenting a radiology project? Well, I'm doing a research sabbatical here in Europe for a month, and while I'm here, Heather Renton, who's the Australian FOXP1 ambassador, suggested that I come and meet you all. So here I am. Thanks for having me. So. Like I said, this is a project that's really been run by my radiology colleagues. So Hina, who's the first author here, she's been the one who's been looking at the MRI scans and also backed up by another radiologist, Simon Mandelstam. So why did we decide to do this project? We know that brain MRI scans are frequently requested in people with FOXP1 syndrome for a range of different reasons, some of which include things like trying to work out what the diagnosis is, or floppiness as babies, or new onset symptoms like seizures, for instance. So brain MRI scans are often done, and also because to investigate the cause of, say, a slightly larger than average head. So kids with FOXP1 syndrome can have bigger than average heads, and so pediatricians often request this scan. We know that brain variations are reported and observed in about half, at least from the literature, that show that there's some brain variations on MRI scans, whilst the other half don't have those. What the limitations of this are that at the moment in the literature, in case reports, the brain MRI scans are reported either in a table form with not that much detail, or if there is a brain MRI, there is actually just a single slice, one image showing one representative picture, and that doesn't give us the full picture of what's going on in the full brain. And I think the other limitation also is that there are some papers that describe people with FOXP1 syndrome can have a range of different genetic genotypes, so different genetic makeup, causing FOXP1 syndrome, including deletion of FOXP1 syndrome. And when you have a full gene deletion, you can sometimes get deletions that are bigger and therefore involve other genes as well. So sometimes the brain MRI scans could be influenced by the fact that other genes are deleted as well. So what we wanted to do was better understand the MRI scans in more detail in people with FOXP1 syndrome, so that we can start looking for patterns and maybe something that might emerge, or clues that might help a radiologist who is looking at a brain MRI scan of a child who may be not yet diagnosed with FOXP1 syndrome, so that they can maybe see something and recommend that this child be referred for genetic testing, for instance, because a lot of symptoms in FOXP1 syndrome in the first 12 months of life might actually be quite non-specific, and so it can be difficult to diagnose. So what our aim was really to systematically study the brain MRI scans of people with FOXP1 syndrome. And this was also prompted by, I guess, Becky's, or one of our local patients' MRI scans. And Becky had a brain scan at 2 years, 3 months. And in her MRI scan, we found that there was an unusual finding of a duplication of the vein of Galen. So usually should be one vein of Galen, and there was also tortuosity of the blood vessels of the venous system. And so that was an unusual finding. I mean, we wondered whether other people with FOXP1 syndrome might also have the same tortuosity of the blood vessels. And you can see here, I'm pointing here, the sort of double track here, instead of just having one track, there's two tracks. It's double vein of Galen, and you can see this. It's a very tortuous blood vessel there, and similarly in this scan here, that's again doubled up. So the vein of Galen has been doubled up there. So it's a distinctive finding, and we wanted to know if this was also present in other people with FOXP1 syndrome. So our methods were that we looked at the literature, what was out there already, what's known about the MRI findings of people with FOXP1 syndrome. We drew up some criteria that we list. Basically, it's a list of all the things that have been described before. We got ethics through our rare disease program, our existing rare disease program at the Children's Hospital. And then we started recruiting through just local contacts and FOXP1 International, the foundation. And also we started data collection through a red cap survey that was sent to patients directly or to the referring clinicians. We then started trying to get MRI scans, and this is where I think we hit our stumbling block, because I think it was quite difficult to actually get MRI scans out of hospitals, even though we sort of had to do a lot of administrative paperwork to try and get release of information with privacy laws, etc. And so of the MRIs that we could get, we got 2 radiologists to independently review the whole scan and then code and work out how many anomalies were identified, and then come to a consensus if there was any disagreement. So we got 26 participants agreed to participate in the project. 13 of them completed all the medical and genetic information that we needed to sort of draw some correlation. And of those, we managed to get 9 full brain MRI scans to actually review. I've got a QR code here, which is better than yesterday. If you do want to participate, it takes you to a website where if you scroll down to the bottom of that website, there's an email that you'll see a rare disease coordinator details and an email that you can email to say if you do want to participate. That QR code will come up later as well at the end, so don't worry. So this is just a high-level summary of our findings so far of 9 MRI scans that have been reviewed. Individuals on the left, A to I, so 9 individuals there, and the neuroimaging, the brain variations across the top that have been reported in people. So this is from the criteria from the literature. And we can see that the most common brain variations agree with what's in the literature. That is, they are differences in the corpus callosum. Corpus callosum is the bridge of tissue that connects the 2 halves of the brain, and lateral ventricles that are different to typical lateral ventricles. And these are the caves within that contain fluid, the little caverns within our brain that contain fluid in the brain. So people with FOXP1 syndrome tend to very commonly either have a change in the bridge of tissue connecting the 2 halves of the brain, or they have differences in the fluid spaces within the brain. There are some other variations as well, and I'll cover those in a minute. What's interesting is that we also wanted to see of the people who had no brain variations or no changes on their brain MRI, whether or not there was any correlation with their severity of their symptoms that they presented with. Oops. And in fact, when we looked at these 3, and obviously this is very few numbers, so it's very hard, you can't really say that this is any statistical robustness at all. But you can see that of the 3, even if you have a brain MRI scan that shows no anomalies, it does not mean that you actually have milder symptoms, because these individuals had moderate to severe intellectual disability or anxiety and anger outbursts, mild ID but had seizures. This one we weren't really sure about the severity of the delays or disability, but this individual did have seizures. So at this stage we can't really say that there was no that it's milder if you don't have any anomalies on the brain MRI. I'm going to show you some pictures of the brain MRI. So just to orientate you, when we do a brain MRI, a child goes into the brain MRI this way. And when we look at the brain MRI images, what we're doing is we're looking up from the feet. Okay, so we're actually looking at the image from the feet. And so if you imagine this is a slice, this is an axial slice, and this is the sort of the horizontal plane. This is the sagittal plane, sort of this way, and then this is a coronal plane, which is sort of this way. So and like I said, if you're looking up from the feet on the axial view, this side of the brain is actually the left side, and this is the right side. So looking at the ventricular system, this is one of the most common findings in people with FOXP1 syndrome. This is a person who is not affected with FOXP1 syndrome. This is a person who, with FOXP1 syndrome. You'll see that the brain ventricles, the lateral ventricles, are often dilated and often asymmetric on both sides. But it's not usually dilated to the point where it's causing increased pressure. So it's not really severe enough to actually require drainage of that fluid. Corpus callosum, again, like I said, this is the bridge of tissue that connects the two halves of the brain. Someone with FOXP1 syndrome will have some changes in the shape of that, and this is thinning of the corpus callosum. This is an interesting finding that we found in 2 individuals with FOXP1 syndrome on their MRI, in that the hippocampi, which are the regions of the brain that are responsible for memory, learning, and emotional regulation, we noticed that there was some malrotation of the hippocampi and a difference in the way that they're positioned in the brain. And so this is found in 2 individuals. We'd like to confirm this in more individuals if possible, so just to see if this is just a coincidence or whether this is a real thing. Is there some weird audio thing happening? Oh, that's not me, is it? No. And some white matter abnormalities that we see also laterally. Is that me? No. Oh, oh, sorry. Okay. And this is finally, and this is the megacisterna magna. This is, again, we heard about this just before, where you can potentially, so this is the unaffected individual on this side, and an individual with a larger than average cisterna magna. So this is a dilated it's called a megacisterna magna in the posterior fossa. So the neuroimaging patterns that we've identified so far in the 9 brain MRI scans that we've done, the lateral ventricles and corpus callosum are the most typically affected. 3 of the 9 individuals had no changes on their brain MRI, but this did not correlate with severity. The other findings that have been reported in the literature, like Chiari-1 malformation, cerebellar defects, and frontal atrophy, were not noted in our study so far, but obviously that's just because it's very small numbers. And the hippocampal malrotation is something that we've identified. We'd like to know if this is a real association in FOXP1 syndrome or just a coincidence. We found that the finding of brain MRI changes didn't really alter the clinical management of people with FOXP1 syndrome, and it didn't correlate with severity. So far, the 2 radiologists that have been looking at the brain MRIs can't really see a very distinctive pattern that distinguishes FOXP1 syndrome from other children with neurodevelopmental disabilities. So there's no distinctive pattern there that can say this is FOXP1 syndrome. But what they have said is that the findings that you see, if you do find these variations on a brain MRI, that they would say this is very suggestive of a genetic condition and that they would recommend genetic testing. So in fact, it's useful if you're scanning a very young child who does not have a diagnosis yet, if they find these sorts of brain variations, that they would recommend genetic testing to make that diagnosis. So I guess the question is what the value is of a brain MRI in FOXP1 syndrome. I think it is still valuable and that it's useful to do, particularly if there's new onset of symptoms, like a rapidly increasing head size or seizures or strabismus, for instance. So, like I said, this is the work of Hina and Simon, a radiologist, and also Alice, who collected a lot of the clinical information. And the project's led by Natasha Brown, who's a colleague of mine. She's a clinical geneticist. That's the QR codes to scan. If you do have MRI scans, it's much easier to get MRI files from parents rather than trying to get them out of hospital departments. That'll take you to a website, scroll down to the bottom, you can click on the Rare Disease Coordinator's email and you should be able to connect with us that way. And I think obviously there are limitations to this study. It's a retrospective study. We're using MRI scans from different ages, done on different machines, done in different ways. So, it's a retrospective study. That's a limitation, but I think hopefully we can get a better understanding of brain MRIs in people with FOXP1 syndrome. Thanks.
Okay, so before we start with the next speaker, I just wanted to share that I had a look at the refster and I was super surprised to see it was almost serene there. So, yeah, so everything goes well, at least with the small kids, those who I've seen. So that's maybe good for you to sit